So far, we have looked at the key terms and key understandings which are related to infection prevention and control in our module. Now, we would be talking about another important aspect or important agenda of the day, which is related to the World Health Organization guidelines on core components of infection prevention and control. So, when we say World Health Organization guidelines on core components of IPC, what is the purpose of this? That is very important for us to understand in order to comprehend and also implement those core components. World Health Organization has pronounced that protecting patient and healthcare worker lives across the world through excellence in infection prevention and control. So, they have also coined, as you can see in the picture, a tagline which says that healthcare without avoidable infections. This is very important in order to achieve infection prevention and control. So, now why infection prevention and control is so important for global health? Because there are so many subjects within the medicine. From all those, why is that one particular topic which is called as infection prevention and control is so important for global health? Because it occupies a unique position in the field of patient safety and quality of care. I am sure you would all agree with me that without infection prevention and control, it is impossible to achieve quality of healthcare delivery and strong healthcare systems. I would not narrate all those IPC contributions to the global health priorities, but you would understand that both UN and also WHO has recognized infection prevention and control as a major topic in order to improve a lot of global healthcare priorities. For example, like SDGs, like AMR, antimicrobial resistance, which is growing to be a very big problem in the world, and also the preparedness for the outbreaks which are happening rampantly the last decade or so. If we are talking about some of those terminologies which we had been getting through the media, that is swine flu, bird flu, etc. These are the outbreaks. Our responsiveness and preparedness would depend on how do we actually understand the infections and also how do we tackle them. Now, we are going to present today the new World Health Organization guidelines on core components of IPC programs, both at the national level and also at the acute care facility level. So, you would see that this is the cover of those guidelines which are published by World Health Organization in 2016. These guidelines are a revision or improvement over the guidelines which were issued in the previous years. Now, when we are talking about actually these WHO guidelines on core components, we would definitely can say that this is a roadmap for how infection prevention and control can prevent harm to healthcare associated infection and antimicrobial resistance. So, all these two terminologies again and again we are repeating them. It is very important to take care of them. Now, the composition of and role of World Health Organization new IPC global unit. This global unit had been working with most of the countries in the world and also the technical experts, and taking the guidelines, taking the guidance, taking the suggestions from all over the world, and assessing actually the guidelines based on the available evidence and expert consensus in order to develop the current guideline. Now, we may ask, there had been World Health Organization guidelines in 2008. So, what is that very different in 2016? Why are these new guidelines on core components, or how they are different from the previous guidelines? By the lack of international evidence based recommendations. Now, this particular revision of 2006 has taken as much of evidence as possible in the world in order to compile them and in order to take them as a basis for providing implementable, realistic, practical guidelines. These guidelines are going to support the countries for the development of their national action plans and also to combat the antimicrobial resistance, and all the field experiences and the research which has gone in the recent times in all the universities and also in all the countries are going to help further advancing the global IPC agenda. So now I would like to show you this slide, again prepared by World Health Organization. I would not actually go through all the elements which are mentioned here, but I would like your attention to be given to one thing, that is new recommendations. What are they? One, it is there is a focus on multimodal behavior. Second one, there is a focus on WASH IPC integration. We have talked about WASH earlier, and this is very important new recommendation which has taken a important place within the new guidelines, and there is a focus on antimicrobial resistance, IHR and IPC interface.